If you, or maybe one of your kids who plays sports, has spondylolysis of the lower back, what is it and what can you do about it? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. Spondylolysis is essentially a stress fracture of the lower back. You almost always see it in young athletes, usually high school age, but you could see it in college. It's even possible to see it in pro athletes. I think maybe Carson Wentz may have had some version of this as a Philadelphia Eagles quarterback. But still, typically high school athletes. It's going to be your gymnasts and it's going to be your football offensive and defensive linemen predominantly because of the repetitive hyperextension of the lower back over and over with gymnasts at somersaults and various tumbling passes. In football, it's going to be the linemen blocking and sort of getting their back driven back, hyperextending it, and it causes a stress fracture in a part of the bone that sort of joins the main part of the body with the part that surrounds the spinal cord. Now, most of the time, this isn't a big deal in the grand scheme of things. Most of the time, it doesn't need surgery, but it can still take a long time to get better. You know, that pain in the lower back with extension maneuvers and things like that, if you keep playing, keeps getting worse and worse and worse. So then you go see a doctor. Maybe you can diagnose it with x-rays, but sometimes you need fancier tests like an MRI or a fancier, more specific type of test for spondylolysis is called a SPECT scan. It's a certain type of CT scan that can show you that area of spondylolysis, or the stress fracture of what we call the pars interarticularis. And it's really something that can take a long time to heal. It can take months. So a lot of doctors will put the patient in a brace. Sometimes we won't do a brace, but we'll certainly shut them down from gymnastics or football or whatever the sport is to try to work on getting them better. A lot of times doing some work with a physical therapist, strengthen the core muscles, strengthen the lower back muscles to alleviate some of the stress on that lumbar spine. The question then comes to, though, return to play. Does that bone actually need to be fully healed, and you prove that with MRIs or SPECT scans, or is it just when the pain goes away? And so I think for this type of problem, obviously we talked about working with a physical therapist on some of those strengthening exercises, also seeing a spine physician or spine surgeon. There are cases of spondylolysis where it can actually lead to bones sort of slipping forward one on top of the other, and then that becomes a bigger problem, what we call spondylolisthesis. And occasionally that ends up actually needing surgery. So seeing a spine-specific physician or surgeon early on in this process, I think, can get you a lot better. If you want more helpful videos on sports and exercise injuries, click the link below. Make sure to subscribe, and I'll see you right here next time.